Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates. With your host, Cindy Gellermini.
Hi, everyone. This is Cindy with another episode of Spectrum Perspectives. And today I have Abby with us. And Abby is a BCBA, which means she does ABA therapy. And she works for Circle Care Services in New Jersey. Hi, Abby. Welcome to the show.
Hi, Cindy. Nice to meet you.
So usually when I interview people, I want to know a little bit about them as a person. I want to know a little bit about their background. Before we jump into what you do for a living, let's let everybody know who you are as a person. So what led you to becoming a BCBA in the first place? Tell me a little bit about your background.
Okay, so I am the youngest of 6 kids, and my oldest brother was born with an intellectual disability. So growing up, I always knew I wanted to work in the field of disabilities. I also have an older sister who's a speech therapist. So I always knew that I was destined to work in the community. I just didn't know what I wanted to do. So when I was a freshman in college, I shadowed occupational therapists, speech therapists, even did some special education classrooms shadowing. And then finally, I had a friend who was an ABA therapist, and she told me to just, dip my toes into that. So I got my first job as an ABA therapist back in freshman year of college. And immediately I fell in love with it. It was the most rewarding out of all the specialties that I shadowed. Coming from a background of having a sibling with an intellectual disability, I felt like I had a passion working with families, and I felt like I connected with families on a different level. So as an ABA therapist working in the home, I felt like I was able to connect with families on a deeper level, and it just felt very rewarding. And I saw the change immediately. Within a few weeks' time, I saw the children progressing in ways that I've never seen before. And I saw the thankfulness of the parents and how happy parents were seeing the progress. So I immediately fell in love with it, no questions asked. And I just went right in right away. As a freshman in college, I knew this was the path that I wanted for myself. So it's been an amazing journey.
Immediate results, right?
Yes, within a week's time, I really, really started to see results quickly. And again, I connected so quickly with the families, and that's what I wanted. I wanted to feel like my job was rewarding. I wanted to wake up every day, excited to go to work, and seeing everyone around me just constantly burn out with their jobs so quickly. I knew I wanted to find something different. And it was a passion of mine, coming from a personal experience and wanting to make change as best as I can.
Tell me a little bit about your brother. Now, he was 15 years older than you said,
Yes.
right?
Mm-hmm.
So did that affect you at all, like as a sibling? What was it like growing up?
Yeah,
because I've interviewed other siblings, and I'll tell you why I asked this, because my girls were twins and they were 5 years older than my son Robbie, and then my other son was 5 years younger, and they had a completely different relationship. The older siblings were very nurturing and caring toward him, and they always took care of him. But my younger son was afraid of him, and his friends were afraid of him, and so it was totally different. So he was a lot older than you. So I'm just curious about the dynamics in the home.
Yeah, for sure. So I know the term now they call a sibling of someone with disability a glass child, right? That's like the new term I hear a lot. So growing up, my brother, he's 15 years older than me, but till this day, we kind of describe him as someone as having the mind of like a 7, 8-year-old. He is verbal. He's able to express himself really well, but he definitely hasn't matured past the age, I would say 6 or 7. So I was actually just talking with my husband recently about this. And as a kid, I never realized that he was an adult. So it was really funny in a way where he was 4 or 5 times our size. He's a big guy. He's 6'2", pretty heavy in weight. And his mind is like a 6, 7-year-old. So he was always with my friends. We would always be playing outside. He would be right by our side. And he has the maturity of a 6, 7-year-old, but he also has a lot of overprotectiveness over us. So I'll never forget it. We would ride bikes up and down the street, and my parents had this rule where we weren't allowed to go past the stop sign both ways. So if he saw us going any bit towards the stop sign, he would chase us down, he would go tell on us. So that was kind of my childhood. We never viewed him as an adult. Until I got older, I started to realize that he was different. So we really included him in all of our activities. He was always right by our side. And I'm not going to lie, there were definitely times where, especially as I got older, I would find it a little annoying that he wouldn't give us our space. I was never the house where I would bring my friends over because he never would, give us our space. He was always included in our things. So as I did get older, I did start to notice the differences. And I did go through a phase, and I'm very regretful of it, and it makes me emotional, where I was a little embarrassed. I was a little embarrassed to bring my friends over because, again, he didn't understand that they are my friends, and he can't come in the room all the time, and he's very social, so he wants to sit there and laugh with us. So there was a phase, I would say, in middle school where I started to notice that he was different, and of course that he had these disabilities, where I did go through a phase of feeling embarrassed of him. And it's something I regret, and I get so emotional talking about it, that I even had that phase growing up, but I definitely think it's something natural.
But that's very normal.
Yeah, for sure. So
I
now
think every middle schooler is embarrassed of their family no
yes,
matter what.
definitely a middle school thing we all go through.
Mhm.
So yeah, I would say elementary school, very accepting. He was the fun brother that was, in my eyes, just one of us. I started to notice his differences. I went through that phase of embarrassment, didn't bring my friends home. And then high school came around where, I became more accepting of him. And I started to realize that, my friends loved him so much. Immediately when you meet him, you just fall in love with him. There's this innocence in him, and he's so caring and so funny. And he's really the popular guy in town. They tell us, like, if there's a secret, do not tell him, because he will go around knocking on every door, telling everyone, my sister's pregnant, my sister's this is happening. So that's a little bit about him. He's just the funny, innocent, sweet 6'2" guy stuck in like a 6-7-year-old's body. I mean, mind. So
Right.
he's an amazing guy.
Where did he go to school?
He went to public school until he was 21. So we went to Clifton High School in North Jersey. Once he graduated from there, he went to a day program from 9 a.m. to 3. So they pick him up from our house, they take him there. So they do teach him a little life skills, cleaning, cooking, swimming. And then he comes home around 3 on a bus as well.
Mm-hmm. Did your mom work? I'm assuming with all those kids, maybe she didn't have time to work.
Yeah, no, my mom was a stay-at-home mom, but
Yeah.
she did start a catering business about 10 years ago. So till this day, she's a little older now. She's nearing like 65. Her knees aren't that great. She just had knee replacement surgery. So she always says he was a blessing from God, because till this day, he's her helper. She needs anything. If she needs she does catering. So if she needs onions from the fridge or cucumbers, he's always the one to help her. So it's definitely been a blessing in disguise, and he's her little helper now.
Yeah, that's nice. So do you think he got ABA therapy when he was in school?
He didn't, but my parents wish he did, because I definitely think it would have helped him a lot, because he does have, a lot of behaviors that I think have been reinforced by my parents because they didn't know any better. And because he is much older, he's about 40 years old now, that they're so engraved in him that it's hard to change. So I definitely think if he did receive, things would have been different.
Right.
Very different.
So I will tell you, my daughter became a special ed teacher, and now my son is a special ed teacher as well. But I remember when she was going to school and she started teaching, she learned all the things that we did wrong as a parent.
Yes. It's so funny, because till this day I go home and I'm like, Mom, you're reinforcing this. Dad, you're reinforcing this. You need to do this. You need to do that. And they're always like, we've been with him for 40 years. Like, who are you to tell us? Yeah. But it's funny, because I can definitely see there are some behaviors in him that have been so heavily reinforced. And at 40 years old, it's really hard to do the unteaching now. So definitely, I think things would have been much different if he was able to receive ABA.
Give me a for instance. What type of behavior?
So a very big one that he has is he needs to have fast food once a day. And he's a big guy, so it's not healthy for him. He needs to have fast food once a day. And he will scream and cry, and my parents will give in and be like, fine, whatever. We're going to go get you, fast food so you can be quiet. So there have been times where I've told them, you need to just explain to him. He's very smart. Just explain to him he cannot have it. It's not healthy for him. They'll try, they'll let him, be upset for 30, 45 minutes, and then they'll give in. The next time he's going to try 40 to 45 minutes, then they'll give in. Then he's going to try an hour. So they keep giving in. They've never actually put their foot down and kept true to their promise. So they're constantly giving him, giving into his tantrums.
And I totally understand, because as the parent, because like you said, he's 40 years old, but he's like a 6-year-old. They're always your baby.
Exactly.
And that's the problem.
That's what my dad says. He's like, he will
He's my
always
baby.
be our baby. Yeah. And my dad gets very upset when any of us try to put these rules on my brother. They can't handle seeing him upset. I mean, I can't either. It's really hard, but for his health, he's much bigger now. And his doctor keeps telling my parents, you really need to watch what you're feeding him. And they feel bad. They're like, I want him to be happy. And I'm like, he won't be happy if he's in a wheelchair at 50 years old, So it's tough.
Yeah, it is. It is. All right. So let's talk about what you do now and how you help other families, right? With these type of suggestions. So when my son, Robbie, he was diagnosed at 2.5 years old with autism. And the day he turned 3, he entered a school for autistic kids. They didn't call it ABA, but that's what they used. That was the teaching method that they used. There was a different word that they called it. I don't remember what they called it, but something intervention or something, I don't remember. When when I first saw what they did with him, they would say, Robbie, do this, whatever, and he had to copy what they did, and then they would reward him right away with an M&M or popcorn or whatever. That's the same method I used with my other kids at potty train them. You reward them, like, here, have an M&M. Good, yay, good job. You went on the potty, right? But it bothered me a little bit in the back of my head, because I remember going to an aquarium or something, and they had the seals do this, and then they tossed him a fish. And I was like, oh my gosh, that's how they're training my child. They're training him like they train animals. But eventually that stopped, the rewarding with the food, and it would become a high five, or a hug. And they did a lot of good job, Robbie, good job. And so I looked at it as positive reinforcement. They taught him with a lot of positive reinforcement. And there was no yelling and no, where growing up, I grew up in an atmosphere where there was a lot of hitting and yelling and over discipline, So I thought it taught me how to be a better parent, because I learned how to not yell and scold and spank and everything for the bad behavior. Instead, you reward the good behavior, So my husband and I are so trained now to say, good job, Robbie, good job. It's like, I feel like we said it all the time.
Yes.
Good job, good sitting, good waiting, good, whatever. But when Robbie was about 3 years old, over one summer, I watched a friend's little boy for the summer, who was Robbie's age. And he was a typical child, and Robbie would go to summer school, and I would watch this other boy. And one day I took them, speaking of fast food, I took them both to McDonald's, and Robbie sat so nicely. They were 3 years old. Robbie sat so nicely at the table, and the other little boy was running circles around McDonald's, and I couldn't get him to sit down. I couldn't get him to behave. And I thought, and that day I said, every kid needs to go to Robbie's school for at least a couple months, just to learn proper behavior when you go out somewhere, when you go out in public. And what I really was saying is every kid needs ABA.
That is hilarious.
So I would like to, I have many different types of viewers. Some people have, they know nothing about autism at all. So I like to, break things down for them, so they explain, so we understand. They understand what we're talking about, because we throw out these terms, BCBA, ABA, all these things. They have no idea what we're talking about. So for those that don't understand what ABA is, can you explain to them what is ABA therapy?
So ultimately, the goal of ABA is to provide individuals with autism a better quality of life by addressing communication skills, social skills, and learning skills in a compassionate way. So there's a deeper understanding of, if they could, they would. No child is inherently bad and acts out for no reason. So it's really important to understand that behavior is a way of communicating. So it's a voice to help get a need, you know? So we really want to understand, what is this child communicating to us? In ABA, we want to help them by giving them the skills and tools they need to do that, to be able to communicate their wants and needs. So in ABA, we really believe in 4 functions of behavior: automatic, which is sensory, attention, tangible, and escape. So by understanding our client's function of behavior, we will understand what they're communicating. So by understanding their function, we are going to understand how we can help them and give them the tools to be able to communicate what they need.
So escape, we're talking about eloping.
Yes. So, so
I had an eloper.
You did, yeah.
Oh yeah.
So, yeah. So a lot of times, eloping, for example, if our client is eloping, what we're going to do is just teach them how to communicate. Maybe they need a break, maybe they need, time to themselves. And we do that by providing them either, if they're verbal speakers, we're going to teach them how to verbally say, I need a break. If not, then we will give them pet cards, an AAC device. We really want to give them the tools to be able to communicate their wants and needs, so we can decrease those maladaptive behaviors. Also, like giving them coping strategies and different things like that as well.
Okay, and what were the other ones besides the eloping?
Yeah, so there was attention seeking. So with that, we can teach them how to functionally request attention, asking someone to play with them. Again, if they're non-vocal, tapping on someone's shoulder for attention. So appropriately giving them the skills to get their need. And then providing non-contingent attention, that's also a really great one. So reinforcing them and giving them attention when they're engaging in appropriate behavior. Like, I love the way you're sharing your blocks. I love the way how you're playing nicely. I love the way you're sitting next to your friend. So giving them appropriate attention when they're engaging in that appropriate behavior. So that appropriate behavior increases because they're like, hey, I just got attention because I'm playing nicely. I just got attention because I was sharing nicely. So they're going to engage in those behaviors more in order to meet that need for attention.
Okay, and what are the other ones?
And then the other one was tangible. So for example, if I see a lollipop, instead of, crying and screaming for the lollipop, I'm just going to simply teach them how to say, I want lollipop. Again, there are those communication deficits that we really need to address and give them the tools to be able to express themselves, whether it be a pet card, an AAC device, pointing, using their words. So we really need to figure out where our client's skill set is and then go from there.
Yeah, I mean, and how do you do it if they're nonverbal?
So if they're nonverbal, then we do things like AC devices, gesturing, all forms of communication are accepted. And that's a really big culture change and shift that has started in ABA, is that we are going to accept all forms of communication, even hand leading, I accept. It's really important to make sure that all forms of communication are accepted: hand leading, gesturing, pointing, even eye contact. If you're looking at the cookie, instead of, engaging that behavior, I'm going to reinforce and be like, oh, you want the cookie? Here you go. So it's really important to meet the child where they are, because every child is different. If you've met one person with autism, you've met one person with autism. So it's really important that we are going to create our plans individually and cater to that child and meet them where they need to be met.
A big issue though is, oh, they want the cookie. No, you can't have the cookie right now. You have to eat dinner first. My son did never wanted to hear the word no. And a lot of them don't want to hear the word no. And that's when you're going to have the throwing on the floor and the tantrum. So how do you handle something like that?
That's a really great question. So what I've seen, what I've learned to really work is visual aids, visual schedule, showing him first dinner, then cookie. Again, you will maybe see the falling on the floor, the tantrums, because maybe he's not understanding that visual schedule yet. But if we're going to keep it going, we're going to put our foot down and be like, hey, look, first dinner, then cookie. But it's really important to give that immediate gratification first so we can teach those visual schedules.
Immediate, in what way? Immediate gratification. What do you mean?
So sometimes kids don't have the skill to wait, right? So maybe we have to work slowly. And again, we have to work with parents. So if parents are really steadfast and no, I don't want him to have a cookie until after dinner, and they're not really being flexible, and hey, maybe we should start small because he doesn't have the skill to maybe wait or even understand that he has to wait until after dinner, because a lot of these children don't have the skill of waiting, and it needs to be something that is taught. So maybe we can use that visual in teaching him, hey, first let's do this really, really quick activity, and then you get the cookie. And then we can slowly extend that window over time. But again, those visual aids are really helpful.
Yeah, my son was not good at waiting.
Oh, yes. It's a hard
I mean,
skill.
if you
It's
read
not
my
easy.
children's books, you'll see the meltdowns, when he goes into the ice
Oh,
cream store and there's a whole long line, immediate meltdown on the floor, another one in
yes.
school, and these are things that really happen. They walk past the cafeteria on the way to the gym. He thought they were going in for lunch and they
Oh,
weren't.
yes.
Meltdown,
Yeah. You
you
see,
know.
visual schedules would have helped so much, and also visual timers. Those are a new thing that have been going, showing so much improvement in our clients, being able to visually see that timer go around and, oh, look, you have 1 more minute, because they're not understanding time. No 3 or 4-year-old is going to understand what 1 minute means. So giving that
Right,
visual aid to them is going to be really, really helpful, as
right.
well as that visual schedule. And it's really important, again, to meet them where they're at. We can't expect a kid to wait 2 hours until after dinner. Maybe we have to start small and then slowly extend that window over time.
Right, right. Yeah,
Mhm.
my daughter, because she's a special ed teacher now, her 2-year-old has a real issue with waiting too, and
Mhm.
and it's Alexa, set the timer for 2 minutes.
Exactly, exactly. You should tell her to try a visual schedule. That really, really works as
Yeah,
well.
she also has she has a clock in his room, and it has a red smiley face, and then when it's time for him to get up in the morning, it turns over to a green smiley face, and he's
I've
learned
heard
now
of
you're
that
not
one.
allowed to get out of bed until you see the green smiley
I've
face.
heard that one. I've heard of that a lot. So I need to try that for my daughter.
Right? Yeah, I
Yeah.
want to come up with some helpful things here in this interview of what parents can use. One of
Yes.
my moms that comes to my retreats, her daughter loves to go to church on Sundays and she loves Sunday school. And
Mhm.
because they do all these different activities and things that apparently she loves. And
Mhm.
she's getting really frustrated because every day her daughter wants to go to church every day. And
Oh,
she which is great,
yeah,
else,
that's so
right? What a
sweet.
better thing, right? Every mom would love that that's what their kids want.
Yeah.
But she's like, "I don't know how to explain to her that, we have to wait until Sunday," and a couple of us chimed in and said, "You gotta have a calendar. You have to show her on the
That's
calendar that today's not church
mhm.
day." You know?
Exactly. That was going to be my recommendation, having that weekly calendar of, look, today's Monday. We have X amount of days until Sunday. That's when we go to
Right,
church. So every day you
right,
wake up, you point to the day and you let her know that today's not church day.
right,
So again, that visual aid is going to be so, so helpful, not just for neurodivergent children, even, typical developing children as well,
right,
because they don't have that concept of waiting. They don't have that concept of 1 more hour, 2 more hours. So
right,
those visual aids are really, really helpful.
right, right. Yeah, I have a family member that has, 3-year-old that's ADHD.
Mhm,
Big problem with the waiting, and
mhm, mhm.
and the
It's a hard
tantruming
one.
and things, and I called an ABA center for them and they said, "No, they need an autism diagnosis." So
Yeah,
I'm like, "What do we do with the
unfortunately.
ADHD kids?"
Yeah, it's a very unfortunate thing that insurances don't accept. But I would definitely say just start with the visual aids and stick to them. Again, it's going to take time, but once they understand that concept, it's really helpful. And I would just start with a very simple first then visual instead of like a 5, 6 visual schedule. That becomes really
Right.
difficult. You want to start
Sure.
small and then build off of that.
Right, just one thing. Right.
Yes,
Okay.
yes,
So
exactly.
when a child is newly diagnosed, the first thing that doctors do is they recommend ABA, right? And
Mhm,
then the
mhm,
moms, well, the first thing they have to do is find an ABA center, right?
mhm,
Um,
mhm.
a- and so this is why I want them to know what it is. But so what do you do typically like in the very beginning with a newly diagnosed kid? Like how do you work with them?
Yeah. So, well, usually the first step is, we go in for an assessment. So the BCBA, the board certified behavioral analyst, will go in, we'll assess the child. And then from there, we'll kind of figure out what the child's skill set is and then go off from that. So we'll kind of build their learning tree or their goals bank from that. So from there, what we do is we like to work with the parents. So this is a really, really important thing is during that initial assessment, we really want to hear from the parents. What are their goals? What change do they want to see? Because we really want to customize our goal bank to what the families want and what's best for the child. So we really like to hear, what are you comfortable with? Because there are some parents who are not comfortable, for example, with certain types of prompting. Certain parents, like you said, don't like edible reinforcement. Some parents don't like this and that. So we really want to hear, what do parents like, what do parents not like, what change do parents want to see, so we can really customize their goal bank to fit that.
So like you said, you've seen one kid with autism, you've seen one kid. So they're all different.
Exactly. So this assessment, we really want to understand them. Who is this child? What is their skill set like? Who is this family? What change does this family want to see? And then we go from there.
I think in the very beginning, though, a parent may not even know what they need, what they want or need. They've just been hit with this diagnosis and their head is spinning and they don't even know what's happening.
Yeah.
Probably the number one thing is they want their child to speak. When is
Yes.
my child going to speak?
Mhm,
They may
mhm,
never speak,
mhm,
but you don't want to tell
mhm.
them that.
Of
So
course, because at the end of the day, no one has that answer. No one knows.
no, you don't know.
So, yeah, so we're here to help the child reach their best quality of life through exactly what we were talking about. And we really want to make sure that we are here to help parents. We are here to hear their story, and we are here to help them reach what they want to reach, and help their child, reach their best potential.
What are probably the most common things that you tend to work on with little ones, with like a little 3-year-old that's just been diagnosed?
So the most common things I would say with a little 3-year-old who's been diagnosed is, at the end of the day, every 3-year-old is different. So do you want to give me like a little example of his skill set? Because, there are 3-year-olds who are, completely not verbal. And then there are 3-year-olds who are very verbal. There are 3-year-olds who are very aggressive, and there are 3-year-olds who are not aggressive. So it really depends on where that child is. But let's start with a child. Let's say that he's 3 years old. His skill set, he's not vocal. Maybe he has a lot of aggressive behaviors. So we really want to figure out, why are those behaviors happening? So we kind of go back to that idea of, no child is going to engage in these behaviors for, every child is going to engage in these behaviors because there's a reason. So we want to figure out, what is that reason? We look at those 4 functions of behaviors by doing a behavior assessment. Once we figure out what the function of those behaviors, we go from there. We'll usually be teaching functional communication skills. So asking for a break, asking for more, asking for all done. And we do this, again, wherever the child is at. Maybe the child needs PECs. Maybe the child needs an AC device. Maybe the child is vocal and can learn words. We also work on imitation
Hold on, I'm going to
skills.
just stop you for 1 second and just explain. A PECS is a picture exchange. I've talked about that early on
Yes.
in my videos. That's what my son used to use, where if he wanted a drink, he had to hand them a picture of a cup, and that was his way of requesting a drink. An AAC device is more of a
tablet. Exactly. Yeah. So that would be provided usually from the insurance or the school. So yeah, so again, we meet the child where they're at, and we kind of figure out, how can we build that skill set? So if they're engaging in certain behaviors, we want to figure out, how can we teach those replacement behaviors, or those appropriate replacement behaviors? Again, it usually goes back to functional communication skills. Also teaching the skill of waiting, teaching the skill of accepting denied access. Okay, yeah. So the first thing to do is really, again, understand the child, understand what their skill set is, and go from there. So it's really important to teach, child how to connect with their surroundings. We do that by teaching appropriate play skills. We do that by teaching sustained engagement. We also really want to focus on functional communication. We want them to be able to express themselves. We want them to be able to express what they need, their wants and needs. It's really important, because once we see them express themselves, we see them thrive. We want them to be able to express what they want. We want them to be able to express what they need. And we'll see that growth from there.
I guess some of the typical things would be, picky eating. They only want to eat chicken nuggets. They don't want to go to bed when it's bedtime. They don't want to take a bath. They don't want to, they have meltdowns and scream. And I think a lot of behaviors that you see are, for a nonverbal child, is because they can't communicate. They can't
Exactly.
their wants and
Exactly.
needs.
Yeah, so that's why it's really important to really focus on those functional communication skills. And again, when they are refusing to take baths, when they are refusing to transition to those non-preferred, that's when we really want to introduce those visual schedules, those visual aids that's going to show them, hey buddy, first we're going to take a bath, and then you're going to get 10 minutes or whatever amount of time of your favorite show. So we really, really want to include those visual aids to really help them with those transitions, those visual aids to really show them that they will be receiving that immediate gratification, that immediate reward, once they engage in that behavior, or that type of activity that we really want from them. And then, for example, like if there are some kids who have sensitivities to the feeling of water. So what we will do is we will slowly start to introduce water through play. So we really want to break it down, introduce it through play, desensitize it until they start to become a little more comfortable. So play is a really key part of it as well.
Right. That's what I was going to say. Some kids don't want to take a bath because they have, sensory issues,
Mm-hmm,
with the water.
mm-hmm.
Some of them don't want to wear clothes. They like to be naked because
Yes.
they've got the sensory issues. Like, how do we work
Mm-hmm,
on them, putting clothes on?
mm-hmm, mm-hmm.
Some kids are addicted to their iPads. If you
Yes.
try to limit their screen time, you're going to have complete meltdowns. Like, these are all things that, how do you work on all these things?
Definitely. So those sensory sensitivities, we really want to make sure that first of all, they are getting occupational therapy. Occupational therapy really focuses on those sensory issues. And from there, we want to be able to collaborate with those occupational therapists and slowly start to work on the desensitization of those sensory difficulties. For example, if they don't like the feeling of cotton, slowly have them play with the material, slowly expose them to it. We don't want to force it on them and make them feel uncomfortable. So we really want to work with an occupational therapist, collaborate with them and help desensitize them from that. What
Uh,
was the other example you gave?
screen time, too much
Yes.
screen time.
Yeah, so too much screen time. Again, that's teaching them the appropriate play skills so they find joy in other activities. Also working on visual schedules, letting them know, hey, buddy, you only have X amount of minutes with your iPad. And then once that timer goes off, we want to be able to teach them, okay, if you want one more minute, buddy, just request one more minute. So giving them that option of, hey, if it's all done, you can request more time is going to ease that anxiety once that timer goes off.
All right, so let's go back now. As I
Mhm.
as I had mentioned, a mom that has a child newly diagnosed, the first thing the doctor says is you get them in ABA therapy. They're going to Google and
Mhm.
they're going to see a lot of negativity about ABA therapy, and then they get scared. And
Mhm.
then they'll go to an autism page on Facebook and
Mhm.
they'll ask about ABA, and
Mhm.
then they're told, you're not allowed to ask that on this page. And they don't understand why. It's because it starts a war.
Mhm.
And so for people that don't understand, um, the autism community is very divided, and you have adults with what I call high functioning autism that um, they go to battle against moms that
Mhm.
are just trying to help their children. And
Mhm.
these adults with autism, they don't like Autism Speaks, and they don't like ABA therapy, and they don't like the puzzle piece. And there's all these things that they complain about. And they say that ABA is abuse. And the reason I wanted to interview a BCBA is because I'd like you to address that, and maybe you can help people understand why maybe they had said that in the past and
Mhm.
what is ABA now.
Mm-hmm, mm-hmm. Yeah, so 20, 30 years ago, ABA was working off of a very scientific approach. It was very focused on decreasing behaviors and blocking anything that may have looked different from others, right? So we really want to understand that there was a time when behavioral therapy practice included treatment methods that maybe were not acceptable today, or maybe even not ethical today. But times have changed. The ABA culture has really shifted by hearing the voices of those adults with autism that you were talking about. We were able to now hear their experiences and understand their perspectives of maybe how ABA was quote unquote abusive to them. And it's really important to not invalidate their experiences and to really hear them, because in order for us to actually evolve in the right direction and to make changes in the ABA world, we really need to hear it from the people who experienced it firsthand. With this newfound understanding, we can now provide that compassionate and trauma-informed care. Although sometimes they may not express it, we really want to make sure that we are teaching our clients to be able to express their emotions and to be able to help them with coping strategies while being compassionate and mindful to the differences that they experience. I know one of the biggest things is ABA therapy, most of it, I know now there are a lot of neurodivergent BCBAs and ABA therapists, but for the most part, ABA therapy was created by neurotypical individuals. So it's the idea of how are neurotypical individuals supposed to be the ones teaching neurodivergent individuals if we don't understand what they're going through and we don't understand, the differences that they have. So it's really important that now we're able to hear from them. Now, 20, 30 years ago, the individuals who are getting ABA 20, 30 years ago are now adults who are able to speak out on what they experience. So now we know, okay, we have to be more compassionate. We have to be more understanding of their self-stimulatory behaviors. We have to be more accepting of it. We have to embrace it and really make sure that we are not we are not molding them to fit into our normal society. Instead, we want to give them the tools to be able to, you know, reach their best potential in this society, and to also help the society accept and embrace them. So things have definitely changed, and they've changed, thankfully, to the voices of those individuals who have gone through that.
Mm-hmm. Yeah, it's the culture. See, Robbie would be 33 now. Okay. So I'm talking 30 years ago. And the
Wow.
culture back then was to cure
Yes.
the autism.
And we
And
now understand that it's not curable. Mhm.
right. And so they did all of these intense therapies to make them stop stimming, give me eye
Exactly.
contact, sit still, act like a
Exactly.
normal person, basically, is what they wanted to do. And they wanted them to stop acting autistic and act like everybody else. And I think that's probably the bottom line here. And that's what, you know, and the thing that I've learned now is they need to stim. They
Exactly.
really
Exactly.
need to, you know, and even as
they
I'm sitting here, I'm swiveling in my chair, you know, I'm doing
exactly.
this, you know, like I think we all probably stim, you know, and don't know that we're doing it. You know what I mean?
We all do. And I think, again, like you said, that's something that wasn't understood and accepted 20, 30 years ago. We all stim, you know, I bite my nails. I can't do it right now, but I'm constantly twirling my hair. So we are all stimming one way or another. And sometimes individuals with autism need to do it a little bit more. So that's something we've definitely learned to accept and understand, because again, like you said, these adults have grown up and spoken out, and it's really important to hear their voices, because truly we won't be able to, you know, move in the right direction without hearing their voices. Many adults with autism are now coming out saying that ABA was not understanding of their self-stimulatory behaviors. You know, they felt stifled when their behavior was blocked. The culture has now shifted again to embracing it, and if there are those inappropriate stims that maybe parents really want to work on, then we want to find a replacement that is still providing our clients with that same sensory input that they need.
Right, right. And what people need to understand is, I mean, there's kids that become adults that I've heard that don't get accepted into day programs because there's the boys are sticking their hands down their pants or taking their
Exactly.
pants
That's
off and things.
exactly.
And those, though, I'm sorry, but
Mhm.
that's an inappropriate behavior that they have to learn.
Exactly.
You can't do that. You know,
Exactly.
we
Exactly.
need to replace that with, I don't know, biting your nails or something, like do
Yeah.
something
Yeah.
else, you know?
Exactly. You know, I used to have a client who used to do something very similar, and he needed that sensory input. So what we ended up finding was, you know, there are these cushions that he can kind of sit on and bounce on, and that gave him that same sensory input, but it looked a lot more appropriate than, you know, maybe like you said, taking off their pants or doing something a little inappropriate in a school setting. So it's really important to also acknowledge that sometimes we may have to be put in a position where we do need to find a replacement behavior, but we want to do it in a way that's going to give our client that same sensory input. We don't want to make them uncomfortable.
Right, right. So you're not trying to make them stop the autistic.
Exactly. Because we now know that you can't, you know, in exchange, you're just going to cause more frustration. We don't want to teach them how to just mask these behaviors. We want to teach them how to appropriately, you know, engage in them in other ways.
Right. I read a story of someone that was autistic that they I guess they wouldn't allow him to stim or do anything in school. He had to sit still all day, and by the end, when he got home, he just kind of went crazy, like just all the
Yes,
clothes came off and the stimming and everything, because he was holding it in all day, and then when he got home, he just had
that's
to
what
let it all
happens.
out.
That's what happens. And we hear a lot now from adults who talk about that autism burnout. And it's exactly what you're talking about. It's the suppressing it all day, and then they just burn out when they get home or over time. So that's definitely why it's really important not to block it, instead teach that appropriate replacement.
Right, right. So when you do therapy, do you go to the homes? Do they come to you? They come to the center? You go to the school? How does it work?
So all three that you said. So there's definitely therapists that go into the school. We also have a clinic, and the clinic is, you know, very embracing of the self-stimulatory behaviors. We do have like a sensory room that has the sensory swing, and so many different fun sensory activities where the kids can go to when they need to kind of decompress. We also do go into the homes. That's mostly what we do. But we also go into the schools and the clinic, and we do have a clinic as well.
Good. Yeah. So if you go into the home, the parents can watch what you do and hopefully carry it over.
Exactly, exactly. Parent training is a really big part of ABA.
Yeah. Yeah.
Mhm.
But see, as we learned from talking about your own family in the very beginning, parents, we don't always listen.
Yes, yes, exactly,
It's
exactly.
easier to have a
It's
therapist do it.
easier. Yes, exactly. And it's also easier when they're younger. You know, my parents, I'm talking to parents of a 40-year-old, so it's much harder to kind of change there. But
Right.
when you do catch a child who's young, parents are usually a lot more open to learn and to implement those changes at home.
Sure. Sure. All
Mhm.
right. So thank you, Abby. So how can they find you? How can they find Circle Care Services? Yeah. Okay. Yeah. Maybe just move the camera a little bit and let us see. There's your contact info right behind you. We just didn't
Yes.
see it before. So it's Circle Care Services, and there's the phone number,
Mhm.
732-574-5178. And what is the website?
So the website is circlecareservices.com. We're also on Instagram, TikTok, so you can find us there as well, Circle Care Services.
Okay, terrific. And you take insurance, I assume?
Yes.
Okay. And then do you have a long waiting list for people to get in to see you?
No, there's not a long waiting list.
No. Okay. And where are you located in New Jersey?
We're located in Central Jersey, but we do provide services all throughout New Jersey, and we've recently extended to Georgia as well.
Georgia. Oh, wow.
Mhm.
That's a far away from New Jersey.
I
I thought you were going to say
know.
Pennsylvania.
I
Okay.
know, I know.
All right, Abby, thank you so much for being
Of
with us today.
course. Thank you. It was really nice speaking to you and getting to know you.
Okay, bye-bye.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.